let's talk about Clearcorrect orthodontic trays. When I first started using Clearcorrect orthodontic trays, my intent was to just do things like correct crowding on lower anterior teeth that had just a little bit of crowding. Now that I've been doing it for several years, I'm seeing that you can correct more severe crowded situations. Now, I personally only do the Clearcorrect trays on adults. I don't do orthodontics on children because they're growing, and I send them to the orthodontist. But I found that adults really like the trays better than the bands. The advantages of Clearcorrect or the other removable trays are patients can remove the trays when they eat, and they can remove the trays when they're cleaning their teeth with floss and toothbrushing. Or if they had some big event, they could take the trays out for an hour. But by and large, it's very difficult to tell that the patients have the trays in their mouth and they really like them. So you can see that this patient had quite a bit of crowding of the anterior teeth. And I would not have done this patient with Clearcorrect trays when I first started using them. Now I'm more confident and realize that we can correct some more severe crowding with orthodontic trays. The plan was to correct the crowding because these teeth are too crowded to correct that situation just with porcelain veneers. So once we finish the orthodontic trays, the plan is to go back and restore the teeth with crowns and veneers. You see we've got crowding here and pretty severe crowding of the lower anterior teeth. So this video is given to our office prior to beginning the case so we can view it, and we also can show the patient what's going to happen step by step with their Clearcorrect experience. And see, you've got a frontal view and an occlusal view of the upper and lower teeth. So this is the frontal view. There are 16 steps. Each step is 2 weeks. So that means there's 30, we'll be through with this case in 32 weeks. Another thing I really like about Clearcorrect, you can tell the patient pretty much to the day when the case will be finished. So this is the frontal view, and we received this prior to beginning the case. Now we actually extracted that tooth prior to beginning the case. This shows where the interproximal cuts will be as you go through and when they'll occur, and the engagers. These are the engagers. So this is the upper teeth. We did not have to extract any maxillary teeth. Okay? And this is a very close approximation of what the final result will be like after the 32 weeks. This is the lower arch, so we extracted this tooth, I believe, okay? Yeah, we extracted that tooth to make room. And that's very close to what it looked like at the end of the case. So here we are in the beginning and here we are at the end of the case. You can see the engagers on the teeth, and the computer tells you exactly what to do. That's another great thing. You're not having to make any decisions for yourself, really. The computer tells you when to place the engagers, when to do IPR, which are the cuts between the teeth, where to do the cuts between the teeth, and they're just little tiny cuts, 0.03 millimeters. You can see this is the beginning of this case, and then we extracted a tooth in the front, and this is how the case ended after Clearcorrect, and now we're ready to begin the restorative part. So here we are before and after. So Clearcorrect is a very effective orthodontic trace system. These techniques work, and they work every time.